Hello everyone, welcome to my channel Ravi Aesthetic Physio. So we will start further topic in pharmacology, which is route of drug administration. So first route is systemic, and in the systemic route first is Entral route. What is Entral route? So the intestinal route include oral, sublingual, and rectal routes. So these are the Entral routes, and the first rule is oral route. It is the oldest and safest, most convenient, most economical. It can be self-administered, non-invasive route. So basically, it is that is their advantage of oral route. There is economical, there is low of cost. There is the oldest. In the ancient time, the people are taking the drug in by the oral route, and the safest. There is no any kind of skin irritation or invasive method occur in this method, and it can be most convenient. The incooperative or unsupportive patient has to be not taken by that medicine by the mouth, but the convenient is to be mouth is the medicine is taken by the mouth with the help of like water easily. This is the advantages. Now the disadvantage. So the disadvantage is slow action. Absorption needs time by the drug administered into the body by the mouth. It will be take a time to absorption and goes to the systemic circulation and at the end of the target organ. So it take a time. Also the drug properties, like some drug properties is irritation or unpleasant. Like it cannot be, the taste is to be good for our taste, and like irritable for the children or like old patient or uncooperative patient. Poor absorption. The absorption of the drug cannot be absorbed by certain physical and chemical characteristics. Like some drugs cannot dissolve in like liver or stomach, but some drugs are. So the first pass metabolism into the liver and kidney or into the mouth. GI irritation. It leads to vomiting. Some medicine are take a vomiting into the into GIT tract or like gastrointestinal tract after eating into the body. Irregular absorption. Irregularities absorption. It will be take too much time. Some of the drug. It will be take low of the time. Some of the drug. The action of the drug into the body after the depends on the time, 6 hour or 12 hour, like 24 hours. Metabolism. The drugs may be destroyed by the gastric juices like insulin. It is like first type 1 diabetes mellitus or insulin is to be like children, like inserted direct into the intravenous, not into the mouth. But type 2 diabetes mellitus is directly given to the mouth by the older or 45 year or more than 45 years of old people. Unsuitable situation. Can't given to unconscious or uncooperative patient. It cannot be taken the medicine if they have phobia of the medicine. Non-compliance. The old patient, elderly patient, they may forget about to take medicine. So that is also the disadvantage of the drug administration in oral route. Next is to be sublingual route. The tablet or pallet containing the drug is placed under the tongue. So drug are placed directly under the tongue and like easily absorption, because under the tongue there is a minute capillaries, there is a highly rich into the oxygenated capillaries and directly absorb into them, and the easily fast into the like migraine medicine take a immediate relief to the migraine. So some migraine medicine are directly inserted into the taken by the sublingual route. So the advantage is absorption is rapid, reaches the circulation. First pass metabolism is avoided. It means there is not destroyed into the liver or stomach. There is directly go to the bloodstream. After the desired effect is obtained, so you can easily absorb that the effect on the body. So what is the disadvantage of sublingual routes? Buccal ulceration can occur. You can take a repeatedly sublingual route of drugs. They can cause buccal ulceration or ulcer into the mouth. And the lipid insoluble. It means some drugs are like insoluble into the lipid, so they can't enter into the like observable in the under the tongue region. Next route is rectal route in Entral route. So what is the rectum? Rectum has rich blood supply and drug can cross the rectum mucosa to the absorb from systemic effect. So why rectum we can use? Because they have rich of oxygenated blood into the rectum region. So we can do some medicine or like drug into the rectum region. So what is the advantages? So gastric irritation is avoided. There is no like reach to the gastrointestinal system. So there is no irritation occur on that place. So there is reduce the chance of vomiting. Can be administered by the unskilled person. So you can if person have unskilled, so they can easily they take or send the medicine to the patient. Useful in geriatric patient and other with vomiting and these unable to swallow. If patient have like phobia to swallow the medicine, and also the children have like fear to take a medicine or uncooperative patient, so we can like try to do insert into the medicine or drug into the rectum medium. And also use for unconscious patients. So there is patient unconscious, so try to give a medicine into the rectum region if the medicine was surrounding is required of that, so we can give that. So what is the disadvantage of rectal routes? So irritation of the rectum occur. You can rectum irritation occur on that time if you can repetition of medicine given to the patient. Absorption may be irregular. The absorption may be irregular because of that the elimination action of the waste material into the water. So the body, so there is to be chances to absorption is irregular. Enema is a drug delivery but a liquid medium into the rectum route, so that is the enema. So third is to be parenteral route. What is the parenteral route? It is the intestine directly delivered to the tissue or blood fluid. So like into the by the intravenous route or interdermal route directly into the bloodstream. So what is the advantage? Action is more rapid and predictable and than oral administration. It means they can fast so the action compared to the oral route, because they can take a time, but after like the oral route is take a time into going to the system circulation, but the parenteral route is directly given to the intravenous or blood system, so they can easily reach out the bloodstream and can show the action easily and like go to the targeted organ. These route can be employed in unconscious and uncooperative patient. So yeah, so this kind of medicine or drug is given to the those patient who have like unconscious or like uncooperative, so they can easily given on that patient. So there is an advantage for preventing the vomiting, or like there is a phobia of taking medicine oral, so we can do that by there is an invasive method, so there is a painful. So gastric irritation can be prenatally and therefore irritation to GIT. It means the gastric irritation will be occur sometimes, but not all the full time. It can be used in patient with vomiting. The patient who have like a vomiting many over the time, so we can't give the medicine by the it is a very useful to for giving medicine on the patient who have like a vomiting on rapidly. So if like a patient is dehydration or like vomiting dizziness, so we can apply the saline into the intravenous route, and there is a very beneficial for that patient. Next is to be disadvantage of parenteral route. So asepsis must be maintained, like this infection of that place is must be maintained over that. So if there is no asepsis maintained, so there is chance to bacterial and viral fungal infection is occur on that place. Injection may be painful. It is invasive method, so painful method of the patient. More expensive, less safe, and inconvenient. Like intravenous route drugs are very expensive for given to the patient, and there is a like less safe because there is invasive method. Injury of nerve and other tissue may occur if patient like if doctor and therapist give the drug by the injection or syringe, so there is chance to insert their nerve or like and many tissues or organ, so make there is also the disadvantage of the parenteral route of the drug administration. So first is parenteral route is injection into the interdermal, so it rising the bleb or BCG by multiple punctures of the epidermis through the drop of drug. Example, smallpox. Like in smallpox condition of the disease, the interdermal route of drug delivery into the body is to be beneficial of like BCG vaccine is given to those patients who have suffering from smallpox disease. Next is to be subcutaneous route. It means the drug is given to the subcutaneous region of the skin by the syringe. So drug is deposited into subcutaneous tissue like insulin or heparin, like type 1 diabetes mellitus of the patient who have suffered from that. So subcutaneous route is very beneficial from that patient. What is the disadvantage? Subcutaneous route is richly supplied by nerves, so make sure if you are injecting some like a syringe or like a needle on that place, so make sure there is nerves are fine on that place, so there is chance to paralysis or denervation occur on that place. So make sure the therapist is given to those place and ensure about that the nerve and artery is not crossing on that place on the given time, or like on the applying of the syringe or needle on that place. The shock absorption is not dependable because it vasoconstriction. It means you have like patient who having a shock, and on that time the vasoconstriction will be occur. So subcutaneous route is not profit on that time to given the drug delivery into the subcutaneous route. Repeated infection at the same site can cause lipotrophy, resulting the erratic absorption. So there is a chance to infection occur on that place on a site, and lipotrophy is resulting to irritating absorption on that place. You can repetitive using the subcutaneous route, so there is a chance to occur the infection on that place like lipotrophy. Next is to be intermuscular route. So directly given to the muscular region of the syringe or needle for the drug delivery. So drug is injected into the one of the large skeletal muscle like triceps and deltoid. So some drugs and medicine given to the intermuscular region or like skeletal muscle and directly injected into that place. Some is like in buttock region, triceps or deltoid region. What is the advantages? Intramuscular route is reliable, absorption is rapid. So many of the doctor or therapists given on the medicine on that place. You have shown that. Advantages: intramuscular injection may be painful, may result in an abscess, local infection on tissue, necrosis, and possible. So if muscular region is very painful because skeletal muscle have like too much sensory fibers to like if you have like a pain, so it will be start pain gate theory. I have studied on the previous video. You have shown that. So they will start the pain gate pain mechanism on that if you are not have acquired experience to giving them like injection or series of the patient. So there is a chance to take a injury on nerve, and there is chances to cause repetitive way the injection on that place. So there is a chance to infection occur on that place of the tissue. The needle may be puncture of the blood vessel. So there is an intermuscular muscular region is a large in which also have the blood enrichment on that place. So there is a chance to occur blood vessel puncture. Next is to be intravenous route. Blood injection is directly given to the venous route. So you have to sound that many places. The dehydrated patient is directly intravenous route is very beneficial on that patient for giving to the blood or like giving to the saline water into the blood. So injection is one of the superficial vein like here. And the advantages, most useful route for emergencies because the drug is immediately available for action. There is very beneficial for those patients who have like dehydration and directly given to the intravenous route or superficial vein. So directly reach out the systemic circulation and show the effect in our body, full body. Provides predictable blood concentration, like the full body concentration of the blood have to be shown on that place. So there is equivalent amount of drug delivery into the full body or like targeted organ. Large volume of solution can be given, like saline water is 200 or 300 milligrams. So you have shown that into the hospital of dehydration or like cholera or infection patient. There is a low RBC and WBC. So given that those patients the saline water, so there is a large because there is less number of WBC found out. Only aqueous solution can given to the fore, but not suspended oily solution deposited into the preparative. Like there is a disadvantage of intravenous route is the aqueous solution is given that place, but not a oil solution given on that place. So there is disadvantage. The solution should be sterile and strict aseptic measures should be taken. So make sure if you are giving the injection on those patients, so it will be sterile and not be used repetitive method. So that is the method. Thank you.